Welcome to my channel. 1. Nurse Emma is preparing to give a cleansing enema to a client experiencing severe constipation. In which position should she place the client? A. Low Fowler's position. B. High Fowler's position. C. Left Sims position. D. Right Sims position. The answer is C. Left Sims position. 2. Which type of patient would gain the most advantage from having their head of the bed elevated? A. A patient recovering from a hemorrhoidectomy. B. A patient who underwent a laryngectomy. C. A patient who had a liver biopsy. D. A patient who received a lumbar puncture. The answer is B. A patient who underwent a laryngectomy. 3. Nurse Peter is looking after a patient who has deep vein thrombosis. What position should he put the patient in? A. Keep the affected leg flat while the patient is on bed rest. B. Have the unaffected leg resting on top of the affected one during bed rest. C. Let the affected leg hang down while the patient is resting. D. Elevate the affected leg while the patient is on bed rest. The answer is D. Elevate the affected leg while the patient is on bed rest. 4. A patient experiencing pleural effusion is set to undergo a thoracentesis. What position should the attending nurse help the patient assume during the procedure? A. Lying in bed on the side that isn't affected, with the head of the bed raised to about 45 degrees. B. Leaning forward in a side-lying position with the bed flat. C. Lying in bed on the side that has the effusion, with the head of the bed elevated to about 45 degrees. D. Lying flat on the back with both arms extended. The answer is A. Lying in bed on the side that isn't affected, with the head of the bed raised to about 45 degrees. 5. Nurse Angelina just got a patient who had a total hip replacement from the recovery unit. What's the best position for her to put the patient in? A. Lying on the side with the affected leg turned outwards. B. Lying on the side with the affected leg turned inwards. C. On the side that wasn't operated on, with the legs spread apart. D. On the side that wasn't operated on, with the legs close together. The answer is C. On the side that wasn't operated on, with the legs spread apart. 6. A patient has just come back to the nursing unit after having a cardiac catheterization done through the femoral artery. What position should the nurse put the patient in? A. Bed rest with head elevation at 30 degrees. B. Bed rest with head elevation at 45 degrees. C. Bed rest with head elevation at 60 degrees. D. Bed rest with head elevation at 90 degrees. The answer is A. Bed rest with head elevation at 30 degrees. 7. Nurse Xavier is getting ready to take care of a client who just had an above-knee amputation on their right leg. What position does the nurse plan to use for the client during the first 24 hours? A. Lying flat on their back, with the affected leg straight on the bed. B. Lying flat on their back, with the affected leg propped up on pillows. C. Lying face down, with the affected leg hanging down. D. In Trendelenburg's position. The answer is B. Lying flat on their back, with the affected leg propped up on pillows. 8. A nurse named Caroline is looking after a patient who has just come back to the recovery unit after undergoing a craniotomy. In which position can the nurse safely place the patient? A. Trendelenburg position. B. Fowler's position with the head tilted to the left. C. Semi-Fowler's position with the head aligned in the center. D. Supine position with the neck bent. The answer is C. Semi-Fowler's position with the head aligned in the center. 9. Taking care of a patient with a serum calcium level of 6.6 mg per deciliter, what changes might the nurse see on the ECG? A. None. That calcium level is normal. B. Prolonged QT interval. C. Shortened ST segment. D. Widened T wave. The answer is B. Prolonged QT interval. 10. When caring for a female client diagnosed with Addison's disease, the nurse should pay close attention to which of the following lab results? A. Potassium level of 3.5 milliequivalent/L. B. Calcium level of 3.1 milliequivalent/L. C. Sodium level of 152 mg per deciliter. D. Hematocrit level of 25%. The answer is D. Hematocrit level of 25%. 11. A patient receiving radiotherapy for mandibular cancer has been diagnosed with tumor lysis syndrome after a few treatment sessions. Which of these phosphorus levels is associated with tumor lysis syndrome? A. Phosphorus level of 6 mg per deciliter. B. Phosphorus level of 1 mg per deciliter. C. Phosphorus level of 4 mg per deciliter. D. Phosphorus level of 2 mg per deciliter. The answer is A. Phosphorus level of 6 mg per deciliter. 12. A female patient visited the clinic with a creatinine clearance of 200 ml per minute. What could be the reasons for this elevated test result? A. Kidney disease. B. Dehydration. C. Congestive heart failure. D. A history of high protein consumption. The answer is D. A history of high protein consumption. 13. A patient who is on parenteral nutrition can receive it through various routes, but not through the following option. A. Subclavian line. B. Central venous catheter. C. Peripherally inserted central catheter line. D. Percutaneous endoscopic gastrostomy. The answer is D. Percutaneous endoscopic gastrostomy. 14. Nurse Charlene is getting ready to set up the first bag of parenteral nutrition through the central line for a patient who is malnourished. What medical equipment should Nurse Charlene make sure is available before she starts the infusion? A. Glucometer. B. Dressing tray. C. Nebulizer. D. Infusion pump. The answer is D. Infusion pump. 15. A nurse is making a follow-up home visit to check on a patient who just got discharged with parenteral nutrition. What should the nurse pay the most attention to during this therapy? A. Blood pressure and temperature. B. Blood pressure and pulse rate. C. Height and weight. D. Temperature and weight. The answer is D. Temperature and weight. 16. A patient is undergoing parenteral nutrition, and the nurse is monitoring for any potential complications associated with this treatment. The nurse should look for which of the following signs that may indicate hyperglycemia? A. High fever, chills, and reduced urination. B. Tiredness, excessive sweating, and sensitivity to heat. C. Rough, dry hair, weakness, and tiredness. D. Increased thirst, blurred vision, and frequent urination. The answer is D. Increased thirst, blurred vision, and frequent urination. 17. A nurse is looking after several patients in a medical surgical unit. She identifies which of the following patients is the least suitable for parenteral nutrition? A. A 53-year-old experiencing ongoing nausea and vomiting due to chemotherapy. B. A 47-year-old patient diagnosed with ulcerative colitis. C. A 59-year-old individual who recently underwent an appendectomy. D. A 28-year-old patient with Hirschsprung's disease. The answer is C. A 59-year-old individual who recently underwent an appendectomy. 18. A patient on parenteral nutrition is reporting a headache. The nurse observes that the patient has a strong pulse, swollen neck veins, and has gained more weight than expected. The nurse concludes that the patient is facing which complication related to parenteral nutrition therapy? A. Air embolism. B. Hypervolemia. C. Hyperglycemia. D. Sepsis. The answer is B. Hypervolemia. 19. Nurse Carol is preparing to insert a nasogastric tube for a stroke patient. What is the most suitable position for this procedure? A. Low Fowler's. B. Sims position. C. Trendelenburg. D. High Fowler's. The answer is D. High Fowler's. 20. A nurse named Peter notices that the patient receiving fat emulsions is experiencing hives. He takes a look at the patient's medical history and considers which of the following allergies might be responsible for the patient's symptoms. A. Egg allergy. B. Peanut allergy. C. Shellfish allergy. D. Corn allergy. The answer is A. Egg allergy. Thanks for watching. For more, subscribe the channel.